Hey guys, it's Jenny with Creature Cove, and today I was just gonna give you guys an update on like the animals and myself. I've had so much stuff done to me. I've been poked and prodded. But let's start with the animals first, because I'm super sad and I need your support. I need you guys to talk me through all this. So, because I couldn't ask my family to do the animals by themselves, I made the decision to give up all of my baby geckos, the crested geckos, which I am so thankful that I have two very good friends. One of them owns a pet store, and he took on like half of them. And then I have another friend who I work at expos with, and she took the other half. And I love them both, and I'll never be able to thank them enough. But I'm also still sad that I had to give up my baby geckos. And my baby giant blue beauty anoles. So the babies, we still have the adults. The adults are just super easy to take care of. I've got the boys just misting them down and feeding them, and that's really all they need. So anyway, it's very heavy on my heart, but that's okay. That's okay. I know they're all gonna go to good homes. I'm sure of it, and I'm okay with it then. So anyway, so that's kind of the animals. Everything else we still have. I guess if you want to hear about my sob story, I came into the hospital last Thursday, and immediately they started doing stuff with me. They were doing ultrasounds, MRIs, CT scans. I've had, I think, 2 MRIs, one with contrast. I've had 2 like full body CT scans, one with, I guess it's called contrast also for a CT scan. I'm not positive. Or dye ink, something like that. And nobody's been able to see anything. Everything looks pretty good. I forget everything all the time now. The doctors don't know what it is. They're stuck on thinking it's either an inoperable brain tumor, brain cancer, basically, or it's an immune disorder. Hi everybody. Just thought I would give you guys another update. I apologize in advance because I haven't answered a lot of phone calls today. I'm not in a good place today. I miss everybody. I want to go home. I hate being here. But let's see, yesterday I had another plasma exchange. And then tomorrow I have another one. Still no change. They were hoping that they'd see some of my symptoms start to go away. But nothing has happened yet. I still can't read and stuff like that. The headaches, though, have gotten a lot better. I had some super gnarly headaches just days ever since my spinal tap, is that right? But I guess it was a side effect or a symptom side. What is it? It's a side effect, not a side effect.
What are you? I wasn't listening.
From the headaches that I was getting was it was because of the spinal tap. But today's the first day I finally can like do something without being in extreme pain with my head. I appreciate all the nice stuff people are sending me, and I can read. I try to read. I have my phone read it to me. Your text messages and everything. And I do apologize. I just can't. Sometimes when people call and I answer, I just immediately start crying right away. So it doesn't really. I never get anywhere with it. So, but I love you all, and thank you so much for your prayers and your thoughts. I'm hoping they're really helping. And I think that's pretty much it for an update. Yeah, I've got 3 more treatments, the plasma exchange treatments, before we do anything else. So, and they're every other day, so I still have a few days, or like a week or something like that left. Hey guys, just another quick update. I just heard from my neurologist. They got the results in for the a lot of like the autoimmune disease things, and unfortunately they were all negative, which means I did all that neck stuff for no reason. So he is calling in for me to do a special biopsy, MRI, I mean. I'm not sure what it means, but it's a certain type, I guess. And we can compare it to what it was 10 days ago when I had one. And then it's looking like I'll probably have to get the biopsy, the brain biopsy. So I should be getting the MRI today sometime, and I don't know if they're gonna want to like take me straight in or what for the brain biopsy, or maybe it'll be magical and it'll be gone. I'm not sure. One could hope, I guess. But I guess that's it for now. I am freaking out on the inside. Yep. Miss my kids, miss my family, miss everybody. And I'll let you guys know what the MRI says. Hey guys, just another update for you. We talked to a bunch of doctors, but I had another MRI late last night. They wanted to see if anything was happening with the tumor, like if it was shrinking from the plasma exchange treatments or anything like that, and unfortunately it wasn't getting any smaller. So then we started talking about just getting the biopsy, and I just met with the neurosurgeon guy. There's a name for it, but I don't remember what it was. And he just kind of said, we don't know if there's a reason to do it. We haven't exhausted all other possibilities of it being autoimmune, which I don't know how I feel about it. I think it's kind of silly because if I do a brain biopsy, we'll have an answer right away, basically, whether it's cancer, tumor, whatever, and we'll know. And things are progressing pretty quick with me. Like, I'm starting to have trouble seeing. My reading's getting worse. My memory's getting bad now. I just feel like whatever is happening in my brain is getting worse quickly. And I'm afraid if we sit around and not do anything for what the actual problem is, and we just do these blind treatments hoping that something will stick, that in the meantime I'm going to be in the hospital for months doing all these treatments, nothing's going to get better, and then it's going to end up something horrible like brain cancer or whatever, and then I lost that much more time at home with my kids. So I don't like the idea of a brain biopsy, but if that's going to tell us definitively what is going on with me, I don't think it's a bad thing, I guess. With that being said, of course, there's massive side effects with a brain biopsy, but yeah. Oh, and the guy had said he's not exactly sure what they would biopsy, because it's so spread in my brain that there's no, like, it's not a regular tumor where they can see exactly where, like, a growth is, or a lump, or, like a solid mass. It's kind of more like just inflammation all over the left side of the brain. So he's not sure if they would even know exactly where to go to get anything that would give us answers. So I guess that is a good reason not to do it, I guess. But so he's going to talk to his boss, the big guy, who will tell us if we should do it or not. And then I could have it as early as Monday if they decide to go ahead with it. If not, I guess we talk about more treatments. I had my 4th Plex treatment, like the plasma exchange treatment. They call it Plex. I don't know what that means, but I'm going to call it that too because I sound professional too. So I had my 4th one today, and I'm due for one more on Monday. And yeah, my boys came yesterday to visit me, and my best friend Cheryl, and that was absolutely amazing. I didn't stop laughing the whole time, and it felt really good to see them. It also felt kind of bad, but I just really want to get home. I want to get home. I don't want to stay here for months doing treatments that aren't going to work just to find out that it is cancer, and then I lose that time with my kids. So, yeah, I don't know. Hopefully the prayers from you guys are doing a little something. I really hope so. If you guys have any questions about anything, let me know. Or any thoughts about things, or any experience. If anybody's had a brain biopsy or knows somebody that did, please tell me. Please tell me about it. Obviously, I'm ridiculously nervous about it. But anyway, I'll talk to you guys soon. Hey guys, I just wanted to give you all an update. I hate this place. I need to go home. I need to be with my kids. Even if I'm dying, I just need to go home. I need to figure it out and get home. But we still don't have any definitive answers. Today, they have what's called a tumor board that's going to meet, and it's like the neurosurgeons, the neurology, the oncology, a couple other departments that all meet about this case, about my case, and because they were disagreeing, the neurosurgeons were disagreeing with neurology about doing a biopsy because they said there's no like actual lesions. It's more like just spread out through the whole thing. It's almost like the brain has turned into this mass of stuff. Or they think it could also be swelling of the brain, and they don't know like where they can go where it's going to be safe because of how much the brain has kind of like shifted. So that's fun. We don't know what's going to happen. I had my 5th and I'm thinking final, it should have been my final Plex treatment where they do the plasma exchange, and we haven't really seen any improvement with that, which is why they're talking about doing the next steps, which is the brain biopsy. Other than that, it's just a roller coaster ride. Every time I talk to somebody, it's something different. Sometimes talking to anybody is impossible. Like the neurosurgeons come in at 4 o'clock in the morning to talk to me, and I can't, like the way my brain is right now anyway, it takes me a hot second to like understand what they're trying to tell me. So to come in at 4 in the morning is like, yeah, I'm not going to remember anything you said. But Neil stays with me most of the time here, and my mommy's coming to visit me today. So I do these videos so they don't have too many people calling and texting me, because it's hard every time. Why can't I get through these things without crying? It's just really hard when I have to re-explain everything, because I'll get to a place where I'm like, not okay, but where I'm not crying all the time, and And then when people text me and ask me what's going on, and I have to explain it all again, it literally just opens the floodgates again. So, like, I appreciate when you guys message me, you know, I hope you're okay, but, like, to ask me fully, like, what's going on, I honestly don't know most of the time. It's these videos, like, when I actually know something, I'll put a video on Facebook so that you guys are kind of up to date with it, but, yeah, we just still don't know anything, so here I sit waiting. But hopefully they'll decide. If they don't do the brain biopsy, I don't know what their next steps are. I think that's why they're doing this tumor board meeting today, because I don't think they know what the next steps would be either. So I think they're just going to figure out, all right, do we do the brain biopsy and figure out for sure what it is? Or do we wait on the brain biopsy and try to do other things? So I don't know if I've said this before, but all of my tests have come back negative. So really the only two things they were thinking it could be is a brain tumor or the other one, because I don't remember it anymore, and autoimmune disease. But all the autoimmune panels came back negative, which they said doesn't necessarily mean that they checked for whatever it is I have, because there's a ton of them. But it still doesn't look good that they all came back negative, and the Plex treatment isn't really helping much. I did notice a little shift in my reading. I can read better. It's still not 100%. I still get stuck on words that are super simple and I should know. But yeah, so yeah. Other than that, I guess that's it for now. Once I hear back from the tumor board, which will either be later today or tomorrow. Hey guys, so I just talked to one of the neurosurgeons people, and they finished the tumor board and decided that I will have a brain biopsy on Friday. So hopefully that will give us some sort of answers. Mainly it's just looking for the cancer to see if it's cancerous, but at least then we know for sure what it is and what we're dealing with, and hopefully I can move on with life and live what I have left to live. I'm trying to stay positive. They do have me on some helpful drugs for depression and anxiety, so that's good. And I think that's about it. I'll be talking to them tomorrow morning, asking all the questions that I have. They do their rounds at 4 a.m., so hopefully I'm sharp and chipper at 4 and I can read all my questions that I have for them.